1. Which part of the gastrointestinal tract is most commonly affected in Crohn's disease? A. Rectum only. B. Colon only. C. Terminal ileum. D. Stomach only. Correct answer is C. Terminal ileum. Crohn's disease most commonly affects the terminal ileum, but can involve any part of the GI tract. Question 2. Ulcerative colitis characteristically affects which layer of the bowel wall? A. Serosa. B. Muscularis. C. Submucosa. D. Mucosa. Correct answer is D. Mucosa. Ulcerative colitis causes inflammation limited to the mucosal layer. Question 3. Which pattern of bowel involvement is typical of Crohn's disease? A. Continuous lesions. B. Skip lesions. C. Rectal sparing never occurs. D. Only left-sided disease. Correct answer is B. Skip lesions. Crohn's disease shows patchy, discontinuous areas of inflammation. Question 4. Which symptom is more common in ulcerative colitis than Crohn's disease? A. Fistula formation. B. Bloody diarrhea. C. Malabsorption. D. Weight loss. Correct answer is B. Bloody diarrhea. Ulcerative colitis commonly presents with bloody stools. Question 5. Transmural inflammation is a feature of which condition? A. Ulcerative colitis. B. Irritable bowel syndrome. C. Crohn's disease. D. Celiac disease. Correct answer is C. Crohn's disease. Crohn's disease affects the entire thickness of the bowel wall. Question 6. Which complication is more associated with Crohn's disease? A. Toxic megacolon. B. Colon cancer. C. Fistulas. D. Rectal bleeding. Correct answer is C. Fistulas. Transmural inflammation in Crohn's disease leads to fistula formation. Question 7. Ulcerative colitis usually begins in which area? A. Ileum. B. Ascending colon. C. Rectum. D. Jejunum. Correct answer is C. Rectum. Ulcerative colitis always involves the rectum initially. Question 8. Which extraintestinal manifestation is common in both Crohn's disease and ulcerative colitis? A. Renal failure. B. Arthritis. C. Myocarditis. D. Stroke. Correct answer is B. Arthritis. Both conditions may present with joint inflammation. Question 9. Which diagnostic test is most useful for confirming inflammatory bowel disease? A. Abdominal ultrasound. B. Colonoscopy with biopsy. C. Stool culture. D. Barium swallow. Correct answer is B. Colonoscopy with biopsy. Colonoscopy allows direct visualization and histologic confirmation. Question 10. Which finding is characteristic of Crohn's disease on colonoscopy? A. Pseudopolyps. B. Continuous ulceration. C. Cobblestone appearance. D. Loss of haustra. Which finding is characteristic of Crohn's disease on colonoscopy? A. Pseudopolyps. B. Continuous ulceration. C. Cobblestone appearance. D. Loss of haustra. Correct answer is C. Cobblestone appearance.
Question 11. Loss of haustration, lead pipe colon, is associated with A. Crohn's disease, B. Ulcerative colitis, C. IBS, D. Diverticulitis. Correct answer is B. Ulcerative colitis. Chronic inflammation causes smooth, rigid colon walls. Question 12. Which medication is commonly used to maintain remission in ulcerative colitis? A. Loperamide. B. Mesalamine. C. Metoclopramide. D. Omeprazole. Correct answer is B. Mesalamine. 5-ASA drugs help reduce mucosal inflammation. Question 13. Which nutrient deficiency is common in Crohn's disease involving the ileum? A. Iron, B. Vitamin B12, C. Calcium, D. Vitamin C. Correct answer is B. Vitamin B12. Vitamin B12 is absorbed in the terminal ileum. Question 14. Which condition has a higher risk of colorectal cancer with long disease duration? A. Crohn's disease, B. Ulcerative colitis, C. IBS, D. Appendicitis. Correct answer is B. Ulcerative colitis. Long-standing UC significantly increases colon cancer risk. Question 15. Which stool characteristic is typical in ulcerative colitis? A. Fatty stools, B. Bloody mucus stools, C. Clay-colored stools, D. Watery stools without blood. Correct answer is B. Bloody mucus stools. Mucosal ulceration leads to blood and mucus in stool. Question 16. Which imaging finding supports Crohn's disease? A. Apple core lesion, B. String sign, C. Pneumoperitoneum, D. Gasless abdomen. Correct answer is B. String sign. Narrowed segments of bowel create the string sign. Question 17. Smoking has what effect on Crohn's disease? A. Improves symptoms, B. No effect, C. Worsens disease, D. Prevents relapse. Correct answer is C. Worsens disease. Smoking exacerbates Crohn's disease. Question 18. Smoking has what effect on ulcerative colitis? A. Worsens disease, B. No effect, C. Protective effect, D. Causes remission failure. Correct answer is C. Protective effect. Smoking appears to reduce UC severity, though not recommended. Question 20. Which complication is life-threatening in ulcerative colitis? A. Fistula, B. Toxic megacolon, C. Malabsorption, D. Perianal abscess. Correct answer is B. Toxic megacolon. Severe inflammation causes colonic dilation and perforation risk. Question 21. Which surgery is curative for ulcerative colitis? A. Ileal resection, B. Partial colectomy, C. Total colectomy, D. Fistula repair. Which surgery is curative for ulcerative colitis? A. Ileal resection, B. Partial colectomy, C. Total colectomy, D. Fistula repair. Correct answer is C. Total colectomy. Removing the colon eliminates ulcerative colitis. Question 21. Surgery in Crohn's disease is usually A. Curative, B. Avoided entirely, C. For complications only, D. Done early. Correct answer, C. For complications only. Crohn's disease often recurs after surgery. Question 22. Which perianal condition is common in Crohn's disease? A. Hemorrhoids, B. Anal fissures, C. Perianal fistulas, D. Rectal prolapse. Correct answer, C. Perianal fistulas. Question 23. Which laboratory finding suggests active IBB? A. Low ESR, B. Elevated CRP, C. High calcium, D. Low glucose. Correct answer, B. Elevated CRP. Question 24. Which immune mechanism is involved in IBD? A. IgE-mediated allergy, B. Autoimmune inflammation, C. Bacterial toxin release, D. Viral destruction. Correct answer, B. Autoimmune inflammation. Question 25. Which biologic therapy is used in moderate to severe IBD? A. Insulin. B. Infliximab. C. Warfarin. D. Digoxin. Correct answer, B. Infliximab. Question 26. Rectal sparing is more typical of A. Ulcerative colitis. B. Crohn's disease. C. IBS. D. Colon cancer. Correct answer, B. Crohn's disease. Question 27. Which age group commonly presents with IBD? A. Infants. B. Adolescents and young adults. C. Middle-aged only. D. Elderly only. Correct answer, B. Adolescents and young adults. Question 28. Which complication results from chronic inflammation and fibrosis in Crohn's disease? A. Strictures. B. Polyps. C. Hemorrhage. D. Diverticula. Correct answer, A. Strictures. Question 29. Which electrolyte imbalance may occur due to chronic diarrhea? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypermagnesemia. Correct answer, B. Hypokalemia. Question 30. Which symptom suggests severe ulcerative colitis? A. Constipation. B. Tenesmus. C. Mild abdominal pain. D. Occasional diarrhea.